period. Never know.
We'll cover for you. All right, we are live streaming. Everybody, welcome to our weekly laser call. My name is Kim Shepard. I'm the Vice President of kokuavida, and we have Mike Barbour, who is the CEO and President of Microlight Corporation, and then we have his Chief Medical Advisor, Dr. Bernard Filner, here today as well. So the subject today we're going to talk about is the sciatic nerve, lasers and the sciatic nerve. So how do we treat it? What is it? Why is it triggered? It causes enormous pain. I've been there before. I used to have that condition a lot. I've been able to manage it on what I know I shouldn't do that triggers that. But as was before I learned, we have a solution for that in the form of an 830 nanometer laser. So let's get started. Mike, tell us a little bit about yourself. If maybe this is the first time someone heard about this webinar, maybe the first time they've heard about microlight, 830 nanometer, just a little bit about that. And then we're going to go a little deep dive in the sciatic nerve and how to treat it. If you have a laser, if you don't have a laser, how to reach out and get that potential solution to a difficult challenge when that thing gets triggered. So Mike, take it away.
Well, Kim, first of all, thank you for inviting Dr. Filner and I to your Zoom call this afternoon. But a little bit of my background, I come out of surgery, the operating room, having spent 10, 15 years, fell in love with class 4 lasers when my doc started doing some laser procedures. And then that led to me picking up some science out of Japan that I brought to America in 1990. At that time, FDA wasn't allowing any laser therapy in America at all, period, without any double-blind studies. So by the grace of God, I get a call from General Motors that wanted to do a double-blind study for carpal tunnel syndrome, which we did, and that got the first clearance of laser therapy in 2002. And at that time, I'd had it patented, so there's no other device like this in America, and I just renewed the patent.
Wow. And that actually brings where kokuavida and microlight come together, because Mike, when he renewed his patent, he found that adding the CBD therapy prior to treatment even enhances the benefits of the laser penetration and results. And so that was part of his patent. And thankfully, we're honored that he chose kokuavida to be his partner in that patent with CBD. And we provide that technology for his laser. And those new products coming out are going to actually perfectly fit and tie in with the laser. And we're really excited about that. So, Dr. Filner, let's talk about sciatic nerve, because this is very, 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 very painful. It can cause you not to be able to walk. It can be a little bit dangerous because you could fall when that nerve gets pinched. So let's number one, how does it start? And then two, if a patient's coming to see you, how do you know that is the condition that they're suffering from?
Well, first of all, it's a very common misconception that all sciatica comes from the nerves as they come out of the spinal cord, and that it may be a disc problem or a what's called a foraminal narrowing at those levels. While that does happen, the far more common cause of sciatica is something called the piriformis syndrome, or similar things. The piriformis muscle in the gluteal area is the primary external rotator of the hip. And you can see if this muscle is tight by having a affected individual lie on their back in a relaxed way and see if the symptomatic leg rotates out. That tells you that the piriformis muscle is very tight. And the sciatic nerve will either go above, below, or through the piriformis muscle. So the most common cause, in my opinion, is the piriformis syndrome. And there are two trigger points in the piriformis muscle that the laser will inactivate and relax that muscle and lead to a decrease in sciatic nerve symptoms. A lot of that depends on how long the problem has been there. If it's been there for a very long time, the nerve may be mildly compromised and take some time to recover. So you don't see an immediate change in the pain. In addition to the piriformis syndrome, which is the most common cause, almost any of the muscles in the gluteal region, if they are very tight, can also give you symptoms either directly by irritating the sciatic nerve or by setting off the piriformis syndrome. In the unusual situation where the problem comes from the spine, you can have a mechanical problem where the foramina, where the nerves come out of the spinal bones, can be narrowed or inflamed and give you a true sciatic problem. Or you could have a disc or multiple discs that have been herniated and put pressure on the origins of the sciatic nerve. But these are not as common and can be pretty much ruled out by an MRI scan. The MRI will not pick up the piriformis syndrome. That has to be found clinically. And by palpating the trigger points in it, you can find what's causing the problem. Additionally, some narrowing, or I should say some tightness in some of the posterior thigh muscles and the posterior calf can also be irritating the sciatic nerve. And that would give you specific symptoms that don't start at the low back or buttock area, but start at the thigh or the calf. And those symptoms can be usually tingling, sometimes numbness, and sometimes weakness. And it can certainly promote falls. So it's important to make the diagnosis and use the treatment. The low power laser is very convenient for treating these problems because along with a CBD, they can inactivate these trigger points with no risk and no pain associated with the treatment. And therefore, you get a lot of patient compliance and they will continue to come back to get a full resolution of the problem once you've started to treat it.
Yes, Mike, you have a question?
Yeah, Dr. Filner, can you explain to the audience the concept of iontophoresis and the laser?
Yeah, well, basically, the concept of iontophoresis has been used by chiropractors and physical therapists for many years because they cannot inject anything in through the skin into the muscle. So they use a system that's been called iontophoresis that involves two electrodes, one active one that contains the substance that they want to move through the skin, and an indifferent receiving electrode that's some distance minimal away from the active electrode. And by applying an electrical field, they're able to push that drug through the skin and into the indifferent electrode that completes the circuit. But what happens with the when you use the CBD, which potentiates the system, and if you apply the laser to the skin over a trigger point, it changes the electrical activity through chemical changes in the underlying tissue. And this does that by increasing the blood flow in the muscles and getting rid of some of the compounds that have accumulated with tight muscles. And that changes the electrical activity of the tissue below, which acts as the indifferent electrode. And by using the low power laser, which uses
Photons.
it uses light rather than electricity or electrons. Although they're still on the electromagnetic scale, it will push the CBD or any other compound that you put underneath the laser into this through the skin into the tissue below. So it functions as an iontophoresis system, just using light rather than electricity.
I want to add a comment there. I actually don't, and Mike, you probably would agree with this. I don't think we've actually even realized the power of this device for the human body. I think there's much more to come on what this can do. And I know there's some current studies going on, even with PTSD, which is phenomenal. I can't wait to hear that completed study from a doctor who's working on it right now. So we'll have that a subject at a later time. As a veteran, that's a hot button there. So Dr. Filner, okay, first let me address that. Your initial what is it and what causes it was comprehensive. So let's say you have a patient that came in and said, I cannot, this one leg just keeps, I feel like I can't walk on it. I don't have strength on it. I have this constant aching in that area that we usually say is the sciatic nerve area. What is your first protocol when using the laser when an individual comes in? Because this is a difficult one, right? You really have to establish first where it's coming from. And as you first introduced, it could be a lot of different things. You have to discover which one it is. And so what's your first protocol if this is an individual who's suffering from this condition? And we know it's temporary, but it can be long lasting. Obviously, we know stretching is really the most important thing, is to stretch consistently. But let's say they've already crossed over into extreme pain. And this pain can go to a level 10. And I know that too. So talk to us about what's your protocol for treating this condition and how to establish what it is from what you said it could be.
Well, the first thing you have to do is take a good history and do a good neurologic exam to see if, in fact, the sciatic nerve is involved with any of the symptoms that can be created. And depending on your findings of the neurologic exam, you may want to see an MRI scan first to make sure that it's not coming from the low back. And once that has been established, usually on the second visit, you'll then palpate for trigger points in the piriformis muscle and any of the other gluteal muscles, some of the paraspinous muscles that may be entrapping the sciatic nerve, and look down the leg to see if there's any tightness in the muscles in the thigh, in the posterior thigh, or the lower calf. Again, that would be guided by your neurologic exam to see exactly where the symptoms are. Once you've diagnosed this as a problem with myofascial pain or trigger points, you then use a drop or two of the CBD on the skin right over where you find the trigger points, and then use the low power laser for 5 cycles at the site of the trigger point. And if on that second visit you get at least a 10% reduction in symptoms, that's a pretty good indication that you're on the right track. And depending on how long the problem has been there, what the patient's physical condition is in terms of their muscular strength, some degree their age, but also that will determine how many treatments you may need to resolve the problem. I would suspect you'd need a minimum of 4 or 5 treatments for a symptomatic problem. and it may be much more than that. I would caution one of the real problems you see with people who aren't as familiar with these things is that they may try to use opiates for pain relief. Don't do that because they don't work. And all that will do is get you into a cycle of increasing dosage because the problem remains and addiction. I can tell you in 34 years of doing pain medicine practice, I had not one patient become addicted. I had patients come to me who were addicted, and I would get them tapered off of their problem. But the key is you have to understand what pain medicines will work if you choose to use medications in addition to the specific treatments. Another thing I would do is I would have the patient bring in a cell phone and come in with a significant other to demonstrate where these trigger points are and take pictures of where they are so that the patient can see where they will need to be treated at home. I do the same thing with their cell phone and stretching exercises, which ultimately will resolve the problem. Once you relieve the pain, the patient can stretch those muscles and return them to normal resting length. And if I've taken pictures of these areas, the patient can be guided and actually not come for treatment to me as often as they might otherwise, which can reduce costs and improve the response in terms of the speed and how many treatments might be needed.
Okay, Mike, over to you.
Dr. Filner, can you share with the office your clinical experience? 20 years as a anesthesiologist and the last 25 years as a pain management doc?
Yeah, well, I was an anesthesiologist for 19 years, and then I developed Meniere's disease, which is a problem with vertigo. And the malpractice company refused to insure me any longer, so I couldn't work in the operating rooms. And luckily, I'd met Dr. Travell a number of years, maybe 3 or 4 years before that. And she suggested that I start a pain practice and referred patients to me. And I worked with her over about 10 years where we discussed cases. I lectured with her a number of times, and I practiced what I called pain medicine, which was an approach that was aimed at diagnosis and treatment and not simply managing the pain with whatever techniques were useful. And that's, as I said, I never had a patient become addicted from what I did. And these are areas that's particular. I might just digress a little bit. Fentanyl and fentanyl patches should really be avoided in these patients because fentanyl is the most soluble of all the narcotics. It is not an opioid because it's synthetic. It is not derived from opium. And I've had patients come in having been treated for several years with fentanyl patches, and their pain problem gets better with the laser treatments over maybe 3 or 4 or 5 treatments. And it may take 6 months to get them detoxified from their fentanyl. So it's something to be absolutely avoided. Like any of the opiates, they should be avoided for musculoskeletal pain that's caused by trigger points because they just don't work. So I've been during that first, up until 2004, when I was exposed to the laser, I had done 600,000 trigger point injections in the first half of that practice. And within a year of seeing the laser demonstrated, I basically stopped doing injections except on rare circumstances. And I've inactivated over 400,000 trigger points with the laser. So I think I've probably had more experience in doing that than just about anybody.
I would probably say you're right.
I've even developed a technique for treating migraine headaches with a laser. And I can stop a migraine headache in 6 minutes with a laser.
That's amazing. And I know that we've had a lot of people have their lives transformed just by that alone, Dr. Filner. So we know the laser is non-invasive. There's no contraindications. But we, I think most people, would you agree, Dr. Filner, are just not quite aware of this device being on the market and the value to potentially maybe even avoiding surgery in many cases, right?
Oh, without a doubt. And I think the biggest problem, aside from the fact that average consumers aren't aware of it, most physicians are not aware of it. And among people who are, let's say, surgeons, orthopedists, neurosurgeons, they will routinely tell patients that it won't work, even though they've never used it and don't know what it is or how to use it. And I would certainly, if you find a practitioner who tells you that it won't work and that it's not very good, you should ask him, number one, how often he's used it.
Yeah.
Number two, what it does. And then the third thing is, I'm going to try it. It can't hurt because it's risk-free and painless. And if you get any response, it's worth continuing the treatment.
Yeah, I mean, the stories I've heard, Dr. Filner and Mike are literally mind-blowing. And as I keep saying, I don't think we've really even penetrated the market for the human condition being able to be relieved of pain through a device like this that's infrared. Mike, go ahead.
Well, you have your own story, Kim, which I think you ought to share.
Yeah, well, I mean, I have a couple stories of the ankle injury, 9 years, not really having much mobility in that ankle. I would have to pretty much tiptoe on the right ankle until I was introduced to the laser, 2 treatments. It was gone. It probably could have been less. I just used the full amount, Dr. Filner. Probably could have been less cycles for the relief I got. So that was probably, I don't know, maybe 4 or 5 years ago now, Mike, and that was 9 years of suffering. And now I don't even remember I had much of an injury unless I sit on my ankle, which is very rare, but I don't really do that because then I do pay for it. And then my jaw, that one was a mystery for why I suffered so long with this jaw issue. And the laser also relieved that. So this is why I show up today, and this is why we'll always show up to share this information, because I am about natural wellness, healing through natural resources, either plant-based medicine or this light therapy is, it's not new technology, right, Mike? It's just you discovered it and brought it here to America. Am I right?
Well, yeah, the Europeans and the Japanese were way ahead of us here in America. And, my science comes out of Japan after having read Dr. Oshiro's report that he had spent, I guess 10 years developing this wavelength, and probably, I think their double-blind study was over 5,000 patients. And, I was deep into laser science and understood what he had developed, and that's what I brought to America, and that's what we used with General Motors to get the clearance.
Yeah, I think
interesting.
Yeah, go ahead.
I might mention a patient recently who I had a Zoom with, who was a dentist who'd been having tinnitus symptoms for years that were becoming disabling, and I introduced him to the causes of the tinnitus. And a physical therapist that he'd been seeing had a laser, and he tried it, and he got a little bit of relief. And I got him in contact with Mike, and Mike sent him a laser to use for a few weeks to try it out, with the idea that if it didn't work, he could return it. So in a few weeks, he calls up and says, "I'm not any better. I want to return the laser." And Mike said he would send him the shipping materials to send it back. Well, I just heard from him. I guess it was either late yesterday or early this morning, that he now has shown some improvement. So he doesn't want to send it back. And that's not rare. It's not common, but it's not rare where someone will have a little bit of success, and then either because they're not doing it correctly or it's just their normal response, they have a situation where it seems to either not changed again or gotten worse. So they want to abandon the treatment, but if they continue, it gets better. So you can't rule out the effectiveness of the laser just by watching only the symptoms. You really need to continue. If you see any response at all, even though it may come and go, you need to continue with the treatment. And it's risk-free, so you don't, and it's painless, so it's not really a problem getting the patient to use the technology.
Well, if you are a doctor, or have a practice of physical therapy, or you would like to be certified in laser therapy, you can do that. You can actually personally acquire a laser and start your own laser business on the side, and be able to live your life like an angel, I say, because there's nothing more gratifying than be able to help people from suffering. And you never know until you're actually in that position of suffering that how impactful that is. And just someone opening their mouth and sharing that with you, or being able to use this laser to help people. And I know Wendy Grafman, she doesn't even charge for treatment. She just does it because she believes in what this laser can do non-evasively. So I want to thank you, gentlemen, for coming on today as we close out. And again, if you're looking to acquire this laser, you can reach out to anyone on the team here, and they will go ahead and get that set up for you. We have an incredible laser course. It's very comprehensive that'll help you get through the knowledge of this. There also is certain conditions, modalities, and how to treat that. And then we'll continually be adding to that course as we keep consistently doing these webinars. They will be added to the information on this course to help people learn how to use this laser, how to treat people with it. And it won't be a guessing game. And like Dr. Filner said, most of the time, if they haven't got results, they haven't either used it long enough or not using it correctly. So thank you, gentlemen, for jumping on today. Anything you want to say before you want to close out, Mike or Dr. Filner?
Well, if there are any problems, just like this dentist that I mentioned, they can always get in touch with the company or me directly, and we can Zoom with them and go over any problems that they're having. One of the things that I've noticed with the treatment for migraine, every drug that you've seen advertised, and they're constantly advertising on TV, they either take significant amount of time to treat the headache, anywhere from 2 to 4 hours or more before the drugs are effective. And what they usually do is the patient needs to be treated over time, because the drugs only take care of some, whether it's Botox or any other medication, only takes care of some of the headaches, and it takes a significant amount of time for the headaches to be resolved, if they're going to be resolved. Whereas once you get skilled, and it only takes maybe a week or so of using this technique, and there's a video of it on YouTube, and the headache will stop right away in 6 minutes. And
I think we put
my
that video.
series,
Yeah. Mhm.
yeah, my series of 12 people where nothing had worked over a course of about anywhere from 6 to 8 treatments, they all have a permanent ending of the migraine, and the headache stops right away. And should it return, the treatment can be continued over a number of times. And it's important to also look for trigger points in the neck muscles that often set off migraines, so that what's important is to persist with the treatments, because number one, they're risk-free. Number two, they're painless. And number three, depending on the individual, how long they've had a problem, it may take a number of treatments to resolve the problem. In 34 years or so, I've had one patient where one treatment resolved their abdominal pain and never came back. So it often requires continued treatment and muscular stretching, and anything we can do to facilitate that is worthwhile.
Very well. Mike, anything you want to say before we close out?
No, thank you very much for having Dr. Filner and I on today.
Well, thank you guys. I mean, it's a pleasure to be able to do these educational webinars. I think we're getting the information out. This is shareable. I see Angela's tagging a bunch of people. She's a huge believer. She did have one question though. If someone has, have you seen this, Mike? This might be a question for you. If someone has a health savings account with their employer, do you know if this would qualify? Yes.
It would.
Okay. There you go, Angela. Hopes that answers that. Dana said, thank you very much. She's also acquired a laser. Her and her husband's a doctor. So thank you guys. We tune in next week. So we'll be here next Thursday at 2 p.m. Bring your questions. Yes, Mike, back to you.
Can I say hello to your to our laser representative in Hungary, Sylvia?
Yes.
Park.
She is killing it. She's killing pain. How about that? I like that. Thank you, Dr. Filner. You're a wealth of information. We're blessed to have you on board to help people understand how valuable this laser is to the human condition. Thank you, Mike, for bringing this laser to the market. We will forever be grateful. The human condition will forever be grateful that you have a solution that is avoiding surgery in many, many cases. Go and find someone who has one in your area, or actually get one and be a angel of light and help people. Thank you, guys. Tune in next week.
I might point out real quickly that if you want to at least give the laser a try, you can always go on the microlight website, tell them what your zip code is, and they will tell you where the nearest practitioner who has a laser. So you may make an appointment with them and try it out, and then either continue their treatment or get a laser yourself. So that website can be very helpful.
Very, very well. Yes, they have a system there. I love that. So again, thank you guys. See you guys next Thursday at 2 p.m.
Thank you, Kim.
Thank you, gentlemen.
Okay.
Bye, Dr. Filner.